An integrated approach to worker health, safety and wellbeing is when you combine the elements of workplace health promotion with occupational health and safety. In an organisation that's introduced an integrated approach, you'd expect to see people working together. You'd see people coming out of their silos to work together to design interventions for important issues. So let's say you've got a workplace trying to be a mentally healthy workplace. You might take work that's been happening under occupational health and safety, such as bullying and the employee assistance program. You'd add elements to that from workplace health promotion, so physical exercise, for example, is really important in mental health. And in addition to that, you'd take elements from HR, which might be about flexible work or redesign of work. And you'd tie all of that together in a coordinated strategic approach. In a traditional model for workplace health and safety, we've treated occupational health and safety and workplace health promotion differently. So they've both been there, but they've been run in silos. So we've assumed that we can separate conditions into work-related conditions and non-work-related conditions, and we've managed work-related conditions using occupational health and safety principles and non-work-related conditions using workplace health promotion ideas. The problem with that is that in most workplaces now, the most common conditions can't really be divided into work-related and non-work-related. So take, for example, musculoskeletal disorders and mental health issues. They're caused by a combination of factors. The benefits of an integrated approach are quite broad. First of all, to workers, you would expect to find that they have improved health literacy and improved self-efficacy around health in a broader sense, not just in occupational health and safety, but in their health more broadly. And you'd also expect to see their health improving, so you should be able to track that. But for workplaces, for employers, you'd expect to see gains associated with a healthier workforce in terms of improved performance. And then that in turn gives you knock-on effects for the community more broadly. What we want to see here is building on the foundation that we have from safety. This is going to require the leaders in organisations to be more involved. It's a bit different to a compliance model. You actually have to think very strategically about what the business goals are and how health is going to contribute to those business goals. One of the things that can be done to get started in developing an integrated approach is to bring together all of the people involved in their different silos. So you might find, for example, there's an OHS committee and there's another group of people working on workplace health promotion separately, often run by HR. And then you've got a whole lot of other activities that HR are doing that aren't really within the line of sight of the health-based activities. So it's quite interesting to bring all of those people together, and as soon as you do, you start to see an effect. You see people, once they realise what other people are doing, there's the potential to coordinate that more, to get a synergistic effect, but also to gain some efficiencies because you don't need to do everything separately as it has been done before.